Every single person will at one point in their life develop some sort of skin abnormality. And in many countries, the wait to see a skin doctor can take weeks and even months. What if you're out hiking with your family and step into some poisonous plants and develop a rash? What do you do then? Well, that's where DermaDetect comes in. They've developed technology that analyzes skin lesions and diseases using digital images, enabling fast and accurate diagnosis. And here to tell us more about it is Eugene Dicker from DermaDetect.
Thank you. Hi.
Welcome. So let's jump right in. What does DermaDetect do exactly?
So DermaDetect, first of all, is a new app in the medical field of dermatology, and it allows quick analysis of your skin disorders and also offer potential solutions and a management plan. So it's based on technology we developed in DermaDetect that uses also the patient's answers to specific questions and the image, the analysis of the image. So the fusion of both of those, eventually, that's how we conclude about the condition you have.
So I talked about it a little bit in the introduction, but let's talk about the field of dermatology, right? Why is this such a crucial app?
So first of all, on one hand, we see a lot of people needing to see a dermatologist, sometimes waiting weeks, even months, and in some countries, years to see a dermatologist. On the other hand, dermatologists, nurse practitioners are doing the work that machine can do easily and more efficiently. So this is where we came. We want to bridge the gap. We want to allow anyone in the world eventually to quickly analyze his skin condition by using a smartphone in a simple process in less than 2 minutes. And also want to allow dermatologists, the physician on the other end, to reach a conclusion very fast and spend less time doing the manual work a machine can do.
So you're saying that the app is actually a replacement for doctors in some cases?
So eventually it empowers dermatologists and physicians. It won't replace a doctor eventually because, first of all, in some cases you need to come to the clinic anyway. But in some cases you can do the analysis remotely and you can use machine to help you to reach that conclusion. So we want to eventually empower dermatologists to be able to see patients and very quickly, not 4 or 5 an hour as an average, but much more than that. Our tool allows them to quickly see the information that's coming from the patient app and reach a conclusion very easily in less than 10 or 30 seconds, which is totally different case in the clinic itself. They spend 15, 20 minutes sometimes on each patient. So that's the difference.
So how exactly does it work?
First of all, you download the app as a patient. Anywhere you are, you just go to the App Store and download the app. Once you did that, you go through a simple process of questions and answers. The app will ask questions, you will answer the questions and take a photo of the lesion. Now, this whole process might take between 1 to 2 minutes, and that's basically it. Once you've finished with that, all that information with insight extracted by our engines goes to dermatologist review. Dermatologists can see the information in less than 30 seconds, reach a conclusion with, of course, our insights. All this conclusion, the information travels back to the patient app, and that's how you see the result on your app.
So I understand you have the app here on your phone. Can we take a look?
Yeah, I do. So first of all, this app is with DermaDetect. DermaDetect is a leading pediatrician portal in Israel. It will be soon available also in other countries such as US. So this is the app.
Okay.
And you answer the questions the app asks you. And just click next, very simple process. Once you click next, you select where your condition is. Let's say I have a condition on my palm or something. So I just click the area and click next. Once I do it, another additional questions, I answer the question. Let's go quickly through the process. I take a photo of my hand and send the photo to our service. Then I click next, answer a few more questions related to my condition. Already now, all the information is being processed, and we ask additional questions based on the information we extract. If we succeeded to extract all the information we need, we will not ask additional questions. Once we have additional questions to ask, we'll go through additional process. So we just click next, and I answer the questions. That's how you go. As you can see, I'm answering questions without thinking, just a quick process. So you'll be able to see. Next, 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 next. Now you receive a message that all the information have
So
been-
basically, you've taken a picture, it's analyzed the picture,
Exactly.
and now you've answered a series of questions about this lesion, rash, whatever you have.
Exactly.
All of this is compiled together and
Wha-
sent directly to the doctor.
Actually, you explained it much better than me.
Okay.
That's exactly the process, how it works. So yes.
And it's sent to the doctor, and what, he provides a response within a certain amount of time?
Yes, currently we're working in 72 hours. We want to give an answer in 72 hours. Sometimes the answer is received in less than 10 minutes. Sometimes it's the whole day. But we are trying to, excuse me, to achieve faster times, of course, as the machine improves, as we have much more dermatologists on the other side reviewing the information coming in from the patient.
Okay, and what stage are you in now?
So, first of all, we are rolling out pilots with leading HMOs in Israel, and soon we will also roll out our application in the United States and Europe. We are still in R&D phase. We will be in R&D phase a long time because we need to train our neural networks for each disease to reach specific accuracy. So we are in R&D phase, but we are also right now funding our company. This is our next funding round, and we are allowing private investors to receive actual shares in the company using Together platform. And you can read about us in TGT-COIL. That's it.
Great. Well, thank you so much for taking
Thank
the
you.
time to speak with us today.
Thank you so much.